Madison residents voicing their concerns tonight over the decision to remove fluoride from city water. On April 15th, Madison Utilities unanimously decided to stop adding fluoride to city water. The reasoning, according to water manager David Moore, was to protect the people and equipment that have to add the corrosive substance to the water supply. Some tonight voicing their qualms with the Madison Utilities Board, saying the proposal is going to negatively affect dental health, particularly among children. But those in favor of the removal have concerns about what's in the water, saying added chemicals can also have detrimental effects on our health. Here's what they had to say.
For every 4 children who grow up in Madison, if you guys make this decision, one of them will get a cavity that was otherwise not going to. A cavity costs $200 to repair on a cheap level. There's 60,000 people in Madison, about 15% of which are children. That's 2,250 children who will get cavities that would not otherwise get cavities. That is $450,000 alone in costs that are going to be bared by the parents of those children to repair those cavities.
People in this world who not as wealthy, are maybe on a limited income, and they may not have that ability to go out and fluoridate, but get fluoridated treatments for their kids since the water would no longer be fluoridated. The dental health communities still are advising fluoride. And so until the American Dental Association stops saying that you should fluoridate the water, I think we should go ahead and continue to fluoridate the water.
We all want to see fluoridation kept because we know the impact. We know the impact it will have on their health, on them missing school, on parents having increased out-of-pocket costs and missing work costs too. We don't want that to happen to our children here. You have one period in life that you're able to affect enamel formation with fluoride, from prenatal till about age 8. After that, there's no way to impact the fluoride or impact the enamel at that same level. And we know that fluoroapatite, this improved enamel, is much more resilient than enamel that's not had that treatment. And that's why this has been around since the 1940s and has 8 decades of science to prove its efficiency and its safety.
Those residents voicing their concerns had to submit a request to speak ahead of time, and the only ones able to speak at the hearing were Madison residents who get their water from Madison Utilities. No decision was made tonight on whether to move forward with the plan. For the latest updates, go to fox54.com. The FDA announcing plans today to phase out ingestible fluoride supplements. These products are recommended for children at increased risk of tooth decay or cavities because of low fluoride in their local drinking water. The FDA commissioner says these products pose a risk when swallowed because they may interfere with healthy gut bacteria that are critical to digestion and immunity, as well as possible associations between excess fluoride intake and decreased IQ. And with local governments like Madison removing fluoride from their water, the need for this supplement is expected to grow.